that was here, look, obviously not as bad as my finger, but if you had a blood vessel and you're tight, you had it clamped onto here, right? So,
Oh.
okay, so let me just pretend.
All right, everybody. Hello, what's up? I am, first of all, let's address the elephant in the room. I'm wearing lipstick. So my hair is gone. 12 plus inches, just completely. We don't know her. She's gone. She's donated. She's off to a happy home, hopefully. But yeah, I cut off 12 plus inches of my hair. So yeah, welcome to my video on surgery. She finished it. When I first started med school, I really thought that I wanted to be a surgeon. She really thought. She was dedicated. She thought she would persevere. She had this vision of being Meredith Grey, like many people do, right? And there were a lot of things that I loved about surgery and a lot of things I did not love about surgery. So yeah, I wrote a couple of notes down, but basically she's not gonna be a surgeon. Bottom line, she's not gonna be a surgeon. It was a really cool experience, really cool rotation overall, but she
will not be doing general surgery like she thought she was.
So basically, this rotation used to be 12 weeks in the past, and it got cut down to 8 weeks. I don't remember why or how long ago I got cut down to 8 weeks, but because of COVID, because of the pandemic and everything, I had to do 2 weeks online back in God, I want to say May or June. I had to do 2 weeks of internal medicine online and 2 weeks of surgery online to make it like a full 8 weeks. So we only had 6 weeks in person. And of those 6 weeks, 2 of them I worked with a colorectal surgeon. 3 of them I worked with a surgeon that is fresh off of residency. And then 1 week I worked with a vascular surgeon. They gave us the option, do you want to do like vascular surgery, breast surgery, or vascular surgery? And I was like, what sounds cool? Anesthesia didn't really seem cool. Breast surgery, I mean, did seem cool, but I feel like I was gonna bump into some of those cases during general surgery. Excuse me. And I totally did. So I'm really glad I chose vascular. I heard that the cases were very, very long. So by the time that I got to it, which was week 4 out of a 6-week rotation, I was like completely exhausted. No, week 5 out of a 6-week rotation. I was completely exhausted and I was like,
did I make a mistake choosing vascular surgery because I am just beat?
This rotation fell in the middle of a winter break, so I did have 2 weeks with that colorectal surgeon, 2 weeks of holiday break, and then I came back and I did the rest of my 4 weeks. And I think all in all, if I could describe this rotation in one word, it would be
exhausting.
She was
exhausted
the whole time. I am not a morning person. We all know this. I say this in almost every single video, but I had to become a morning person and I had to be on it, you know? Sometimes I would wake up right at the last minute because I just wanted an extra 5 minutes of sleep and I wouldn't even get coffee, and man, was I. So basically, what I kind of wanted this structure to be if you will, is I kind of wanted to say some general things about surgery and then delve into my experiences with each person or whoever, whatever. I think it's important to consider the, I guess, stereotypes that exist in medicine. I remember that when I first started, I was really determined to go into general surgery. I thought it was super cool. I didn't really see myself as a primary care physician. I didn't see myself as a primary care physician. I'm like, their lives must be so boring, day in and day out, managing high blood pressure and diabetes and trying to change people's habits, trying to get people to stop smoking and they won't stop smoking and all of this stuff. I'm like, I don't want to deal with this. I want to be able to work with my hands and not deal with that. like not deal with people being people, you know? And as I went through each of my rotations, I never really canceled anything. And I always enjoyed every single rotation, and this rotation was no exception. I think surgery is totally, totally cool. I got to see a bunch of cool things, I got to do a bunch of cool things, and I met a lot of really great people. So obviously, you know, we're in surgery, so there's this very extensive process of like putting on all of your gear and taking it off, and just how everything needs to be totally sterile. If you're someone who likes to stay organized and likes to know where everything's at all times, and you can perform under pressure, I would really suggest that you become a surgical tech, because those people are so organized. They have everything laid out. They have to count everything, like down to the last suture needle, down to the last lap pad, down to the last instrument. Like every single instrument has to be accounted for, because God forbid you close up the patient and you're missing, I don't know, a towel or something, you know, because that's happened before. It's not unheard of that happens in surgery. Not often. Like it never happened when I was there. The surgical techs are super good at their job, but I do think that it is a good job for those of you that like really like to be tidy, really like to be organized, really like surgery and don't mind blood and gore, but don't want to do med school, don't want to go into surgery, things like that.
So I'm going to show you right quick how I get ready. So I scan my badge and I press dispense, and wow, I'm really good at this ASMR stuff, right? I do what it tells me to do because I am a sheep. And oh no, there's my scrubs. This is totally at a different hospital, but oh, you look, there's me looking cute in my scrubs. Ooh yeah, girl, strike a pose. Awesome. Yes. All right. So we are gonna need our badge, because we need our badge to get anywhere and everywhere. It's illegal for you not to have a badge, so yeah, I gotta make sure I have that. Then I am putting my little hairs up, making sure I'm getting all of them, but you know, I like to take my sweet time. Hurry it up, Noemi, hurry it up. Oh, wait, oh, there is no hair tie. Where is my hair tie? Where is it, girl? What? Oh, there it is. Good job, Noemi. Yeah, all right, let's move it along. So yeah, putting my hair up. No, ooh, yeah, nice little lick all the baby hairs out. And I have to take my glasses off because my face is small, and I need to put the mask on and make sure it is covering all places. Usually I'll put an N95, but this was a robotic surgery day, so I just put on a regular mask. And then a fabulous hairnet. Make sure all the hairs are in there. Oh my gosh, who's cute? Oh, girl, me? Yes, I know, stop. And then my mom bought me some Brooks because I have flat feet, but we can't just wear that. We need some shoe coverings in case there's like blood and guts and poop. So yeah, gotta look stylish, and that is the complete look. Ooh, yeah, so stylish. Yes, girl, work. And then just random gloves in my pocket. Okay, that's it. Goodbye.
When I first started med school, I feel like me, along with a bunch of other people, kind of had this mentality that like surgeons were the only doctors. Like they were like the main doctors, the ones that really got like stuff done. You know what I mean? And yeah, just kind of like looked down upon primary care physicians and really like kind of, for lack of a better term, shat on them, you know? Like it was like nobody wanted to be a primary care doctor, and I kind of fed into that as well, you know? I had these misconceptions of like, if you're not a surgeon, then you're not really a good doctor. You're not really smart, and that's totally not the case at all. So one of the things that I really struggled with was that, you know, the third and fourth years, when I was a first year or a second year, would always say like,
You don't have the personality of a general surgeon. I don't see you doing general surgery.
and that really bothered me, because I was like, how could you have a personality to go into a profession? Like if you like something and you want to do it, why not just do it? Why do you have to have a personality for it? And honestly, coming into surgery, that couldn't have been more true. I really do think that some of the stereotypes that have been said about, you know, certain physicians in certain fields ring pretty true. For example, a lot of the surgeons didn't really have a lot of patient interaction like I would have really liked to have. And I think that that was one of the biggest defining moments for me. It was like, wow, you know, you really liked getting to know patients and you really like talking to people, and you just don't really do a lot of that in general surgery, you know? And yeah, some of the days when I was like so tired, I was like, you know, I don't want to talk to anybody. So this rotation's perfect, right? So yeah, there's definitely personalities for everything. That does not mean by any means that you should not go into a profession because your personality isn't the majority. Just know that if you're like a happy, peppy, happy-go-lucky person, it might be a bit, I don't know, a bit of a learning curve, you know, kind of getting used to that environment, because it is an environment that I had to adjust to, and it was a little difficult for me in the beginning. So personalities are real. Stereotypes are real. I hate to say that, but personalities really do ring true in some cases. So yeah, I got to see a bunch of cool stuff. My first 2 weeks, like I said, I was with a colorectal surgeon, and I think the biggest learning curve for me, or the biggest like obstacle that I had to face during the first week, was that I had just come off of family medicine and internal medicine, 2 rotations where I was like completely enveloped in a patient's care. I was super like involved in every aspect of everything. So I was used to just talking to patients, taking the initiative, doing all of that. And that first week, I felt like I was really deduced down to like a fly on the wall. There wasn't any like patient interaction that I really got to do. It was mostly shadowing because I started my morning off in the clinic, and then after that's when like we would go to surgeries, or sometimes he would have surgeries in the morning and then clinic in the afternoon. So it was a really, really weird thing for me to get used to. Like, oh, I'm not talking to anybody, I'm just kind of watching you talk to people, you know? And I didn't really like say much. I didn't really I don't know. It was really tough to read the first surgeon, because I mean, obviously he was tired all the time. They do so much. Their calls are insane sometimes. So, I mean, I wouldn't worry about a medical student in that state either, you know. But it was an interesting learning curve for me, just kind of going from being super involved to not being involved that much. At first, the surgeon seemed a little bit cold, but I feel like after, you know, a couple of days, we kind of got used to each other. I would like try to make conversation here and there, and he ended up being like pretty cool. We ended up talking about like our favorite music and stuff like that. We had a lot of musical tastes in common in the OR. So that was pretty funny. That colorectal surgeon is one of the few that does robotic surgeries. So I got to see a lot of robotic surgeries, and while they're super cool to do, as the student, they're not the coolest to be part of, because you're not doing anything, you're just watching, you know? And it's like, okay, well, I mean, I could watch this on YouTube. You know, there's just not a lot of like mental stimulation that goes into like seeing robotic surgeries as a student. They're super, super cool, super awesome, but like I said, when you're a student, there's not much you can do because it's all being done on a robot, right? But yeah, he did a bunch and it was awesome. Like I said, he specializes in colorectal surgery, so we saw a lot of buttholes.
Lots and lots of buttholes.
He had a lot of patients that had hemorrhoids, that had fissures. So if there is one giant takeaway that I can take from working with him, is that whenever you go to the bathroom to poop or to pee, go by yourself. Don't take a book, don't take your phone, don't take anything. Go, get on the toilet, do your business, get out. Spend as little time on that toilet, like actually sitting down on that toilet, as little as possible, because I have seen some angry looking hemorrhoids. And if you are not regular in your bowel movements, please get some fiber. There's so many fiber supplements out there, please. I am telling you, these people were in so much pain. They were adults, like adult men crying because this was just so painful. So if that's probably my biggest advice to you, is to just go to the bathroom, do your business, get out. Don't spend a lot of time on the toilet, because I've seen what the physical exam looks like in anoscope. Let me just look this up for you, because I just I can't be wrong when it comes to this. So, what he would use to look inside a person's butthole is an anoscope, and an anoscope is 10 centimeters long, and that's the smallest that they come in. So he would put lube on it and then just slide it in, and it has like a cone in there, and he would like take the cone out so that it was just like a speculum. So he was just looking like all up in there, seeing like what your butthole looked like. And people were in so much pain all the time. And sometimes he would have to take it out and put it back in. And 10 centimeters, I think is a lot. I don't know about you, but I think it's a lot. And like I said, that's the smallest that they come in. There's also proctoscopes that are 13 centimeters long, and rectoscopes that are 25 centimeters long. So if I can, I'll pop up a picture, but it's insane, fam. You do not want to deal with hemorrhoids. I'm telling you right now. Please, fiber, stay off your phone when you're on your toilet, get in, get out. That's it. Please take care of your butthole. Because these people were not okay. Oh, another cool thing that I saw with him was that because he has a lot of GI cases, he works a lot with the GI doctors. So GI doctors usually go through like their internal medicine residency, and then they specialize in gastroenterology. So these are the people that are going to be doing your colonoscopies, hopefully starting at 50. Everyone should be getting a colonoscopy, especially those that are high risk. So one patient had rectal cancer, and what the surgeon did, which I thought was really cool, is that he actually went to do the colonoscopy himself instead of having a GI doctor do it. And I don't know if this is common among surgeons, but he actually took the time to go and do the colonoscopy on this patient. So what ended up happening was that, you know, he stuck this tube into this guy's colon, you know, to look all, or his rectum, to look all around his colon and to find the specific part that had the cancer. And there was a nurse that was assisting him, and she ended up injecting like tattoo dye into this guy's colon. And that tattoo, they just put it like like if this is your colon, they just like tattooed it in all these different spots. So that the next day when he was operating on him, he knew exactly where to resect the cancer. Just so like the surgery would just be quicker, and he wouldn't have to spend time looking for where the cancer was. He kind of just like knew where it was through that tattoo. And it's a tattoo, like it's a tattooing. So I just thought that was super interesting, how
There's tattooing and surgery?
you know, like there's tattoos and surgery.
What? You can get your colon tattooed or whatever?
So I thought that was pretty cool. So yeah, I spent those first 2 weeks with him, and it was pretty dope. I also had to do 3 full shifts on call. And this was at a completely different hospital system, and I got to see some pretty cool cases. They were mainly ortho surgeries. So the first surgery I remember I walked into, it was this guy, his leg was just completely like split in half and like opened, and there was blood everywhere. And I got there at 6 p.m. because my shift was from 6 p.m. to 11 p.m. and the surgery had already started, you know, and I was like, oh, is this person involved in like a car accident, or like what's wrong? And they're like, oh no, like this is just an ortho surgery. So I guess, I don't know, I wasn't expecting for ortho surgeries to be this bloody, but they were. And it's honestly really like aggressive, you know, there's a bunch of screws, there's a bunch of hammers, there's a bunch of drills. So it's really not for the faint of heart. Like if you're going, they're pretty gruesome. Oh, and another thing that happened with ortho surgeries was that you have to wear lead the entire time, because when they're pinning like bones and stuff like that, you have to know how deep the nail goes into the bone. So you have to constantly be taking x-rays, and obviously that's radiation, so you don't want anybody to be affected. So you had to wear like a thyroid collar or a neck collar to protect your thyroid. You had to wear like a chest piece and then a skirt. So all of that in total was probably like 13 pounds. So imagine going like an hour and a half, 2 hours, 3 hours, sometimes even 4 or 5 hour surgery, just wearing all of that garment on top of everything that you have to put on, you know? So it was a bit intense. because, you know, everything has to be completely sterile. So, you know, you're dirty underneath and then you have to put all the sterile material on top. So it can get really, really toasty in the OR, except in robotic surgeries where I had no shame. And I was just wrapped around in one of the heating blankets that they use for patients. So yeah, that was one of the ortho surgeries. On another call day, I met another ortho surgeon who was so cool. I had such a great conversation with him. I honestly think that conversation was one of my favorite in this entire rotation. He did like his med school and his residency in California, and then was like, I think he went to Johns Hopkins or something like that. I don't know. He was a pretty impressive guy, but he was basically saying how he didn't match for 3 years. So he, you know, worked his whole time during med school to go and be an orthopedic surgeon, and he didn't get in. 3 times he didn't get in, and he like never gave up. And it was just, I don't know, really touching to me. So, you know, he started asking me a little bit about like me and like my background, and that's not really common, you know. I feel like in surgery, I feel like a lot of people are very like go, cut, that they don't really care to get to know like the student a lot of the time. But he did, and he really like asked me about me and my family and my background. And I told him, you know, like, this is what I want to do with my life. This is what I think is cool for me. It's all about like accessibility, like really reaching the communities that I want to work with, which is like the Latinx community, which is the undocumented community, classically marginalized communities. So those that are like underinsured or uninsured, like those are the kinds of people I want to work with. And he was just super like inspirational, because he was like, your parents must be so proud. Like snoring. But yeah, he was like, your parents must be so proud, because there's just this tenacity that people from your generation have. He was like, you don't come from doctors, so you have to claw your way up into everything, and there's not a lot of people that look like you, and you know, it's difficult to be the first in your family to do something. And I think that so often in med school, I am just so exhausted. I don't have time to just stop and think about my feelings or think about like what I'm really going through or what I'm doing. I mean, I have therapy like every other week. So I have, you know, those reminders to like, hey, Noemi, it's time to stop and really like take a breather and think about like what's been happening, because sometimes I just go and I don't think, you know, it's just like on autopilot. So just hearing the surgeon telling me these things, a white surgeon, you know, telling me these things, it meant a lot, because it's like, you know what, you're right. I had no idea what FAFSA was. I had no idea how to like apply for loans in college, how to like get support for med school, you know, and it just put a lot of things into perspective. And like, even now watching my partner go through like applying to residency, it's like he's doing this for the first time, you know, and there's not anybody that can really help him out from personal experience. And yet he has a lot of classmates. I have a lot of classmates that come from a family of doctors and know exactly what to expect, you know. So it's just, I don't know, it was really interesting hearing him put things into perspective for me, and it really made me feel validated, you know. I thought he was really cool, so I'll think about him often. And he bought us Chipotle, so I can't complain. So yeah, those were my on-call experiences. It's exhausting talking by myself to myself in this camera, even though I'm talking to you, friends and family. And by the way, Mom, if you're watching this, if you're watching this, you are watching this, Mom, I know you. But at least I got some laundry done. But it will get folded, Mom, so don't come for me in the comments. Moving on to vascular surgery. My week of vascular surgery. Guess what? More lead. So vascular surgeons work a lot with what? Vascular things. So veins, arteries, diabetic foot ulcers are the ones that do like the amputations of like diabetics who are uncontrolled and have really bad diabetic neuropathy, or have a lot of like claudication symptoms where they can't really walk and they can't really feel their toes or anything like that. So he's the guy that has to amputate them. So yeah, pretty interesting stuff. I really enjoyed my week with the vascular surgeon. I think if I were to go into surgery, which I'm not, I would definitely do vascular. I thought it was really awesome. And like I was saying earlier, apparently it's like the bane of all of general surgeons' existence. Like they hate it because it's like tedious and all of that. But I don't know if I worked with like a really good surgeon, but it was like not tedious at all. So I got to see some carotid endarterectomies. So basically what they did is that like they had plaques in their carotid arteries, and he just like went in and he like scraped out the plaque, and the whole time I was like, oh my god, you're in her carotid artery, you know, like that's so cool. And these are like pretty bloody. So for a general surgery case, the average amount of blood loss is probably like 20 milliliters, so not a lot. And for these, I think it was like in the hundreds. I mean, nothing compared to like C-sections, because mama, the average blood loss in C-sections is 1,000 milliliters. That's enough to kill an 18-year-old boy. Okay? Women are superior. I don't want to hear it. Yeah, so they were really bloody, and I was just so excited from the get-go. Again, a super serious guy, not a guy that says a lot. So he communicated a lot, like with the surgical tech and with the nurses, with a lot of grunts. So he would be like, instead of saying, oh, can you hand me like scalpel? Can you hand me like the hemostat? You know, he would just be like, and like the nurses like and the surgical techs had to be on it. So yeah, definitely different from like my bubbly personality, but we like totally vibed. Like he was super cool. Yeah, he took the plaque out of the carotid artery, and I was like, oh my god, can I feel it?
Can I feel what that feels?
He's like, yeah, sure, whatever, man. And I was like, oh my god, this is like one of the biggest killers in Americans, you know. This is like the biggest killers actually like here in Latinos and everybody, you know, because of such a crappy diet that people follow, where you eat a lot of fried foods and you just eat a lot of crap. It clogs up your arteries, and I got to feel some of it, and it was like gummy, and I don't know, it was firm but like a little gummy. And I just remember thinking like, I can't have potato chips after this, you know. I need to cut down on like the fried food. And I mean, I already don't eat meat, but like y'all should really watch what you eat, because I have seen it. Like surgeons basically get the people that haven't taken care of themselves and have neglected themselves to the point where like surgery's your last option, you know, like that's, you got yourself to that point. So don't get yourselves to that point. Just don't do it. Oh, and mind you, like he let me staple all of these people shut like the entire time. So if there was like any like scar that he would make, instead of like stitching it, well, superficially, because you have to stitch like the fascia, like the layer underneath. So he would sew that up, and then like he would just put the skin together, and I would like staple it, and I just felt so good. So that was really awesome. So yeah, I got to do that. And one of the coolest surgeries I saw with him was this person had ischemia. Like he didn't have proper blood flow going from like his main vessels in his abdomen down to his legs, so he couldn't walk for a very far distance. He had to take a lot of breaks, because obviously when your muscles aren't getting a lot of blood, when they're not getting all that oxygen, they're not getting fed, so they're gonna give up pretty easily, pretty quickly. So what he ended up doing was he connected like the one of the arteries from up here, from up in the thigh to down near the shin. And the way that he did that was that he had to sacrifice this really long vein. And you can look this up on Google. It's called a saphenous vein. It's a very long vein. I think it's like the longest one in your body. So it kind of runs a little superficially. So he removed that, and obviously he had to have an assistant. So I met another vascular surgeon who was a lady, and I love seeing women in surgery, because actually I got to see quite a bit of female surgeons. Yeah, so with her help, they got that vein, and then they did a valvulotomy. Then they did a valvulotomy, which is just a big fancy word of saying they took all of the valves out of that vein. So the main difference between like arteries and veins is that veins have valves, so they are unidirectional. They go in one direction so that they don't like kind of back up, go to the wrong place. So if you start at your heart, the arteries are carrying the blood away from the heart, and the veins are bringing blood back into the heart to get it to the lungs, to get oxygenated, to then go away from the body as arteries and then feed the rest of your body. So they had to like take all of the valves out and then make sure that it was intact, that there was no holes in this vein. And then they ended up connecting the artery. So now it's like vein to artery. So they ended up connecting one end of that vein to the top of the artery and the other part of the vein to the other artery down in the leg. So that basically it made a circuit. So if like the blood flow was going down this way, it was now going this way. So it was bypassing kind of this like really weak artery. So I thought that was so cool. And again, super bloody. When we were like finishing up and I was helping him out, he like did something where he like pulled back and a bunch of blood splattered, and it ended up getting splattered on my glasses and on my mask. It was so gross, but I was like,
Hell yeah.
you know, I thought it was so cool. Like, vascular surgery really is super cool. So I had a good time and I had really great conversations with him. He, I think, started off again in California, and then he did med school in Texas, and and again, he asked me like what I wanted to do, and I was like, oh, I don't know, OB-GYN or family medicine with an OB-GYN focus. And he was like, oh, you should really check out this residency program. It really works with people at the border. So I thought that was really cool, you know, that he was like really invested in like telling me what he thought, what kind of residency I would like, you know. So I thought that was super duper cool. So we ended up having good conversations about his family and what I wanted to do, and I was like, okay, any advice? I always ask, you know, like, any advice you have for me or any feedback. And vascular surgery ended up being pretty cool. All right, so the last surgeon that I worked with is the surgeon that I worked the most with, and he was a Black surgeon, which I was super excited to work with a minority because there's not a lot of minorities really in medicine. I feel like the more you go up in higher education, like the more specialized you become, the less people look like you. And I have yet to see like a good chunk of Latinx people, really. Specifically Latinas. There's not a lot of Latinas that I have worked with, and it might just be like a Rockford thing, but it just goes to show that we still have a long way to come in medicine. Yeah, I think at the top of my head, all I can think about is 2 physicians that I worked with in my peds rotation that were Latino men. But yeah, there's not a lot of us in higher education, unfortunately. So I was really excited to work with him. And he was a physician that had just graduated from residency a couple months back. So this is like his first attending job, I believe, or his first, you know, couple months as an attending physician. And I really, really enjoyed working with him. He had such a great personality. He was so nice, so sweet, and just like an all-around good person to be around. And he did everything, so I got to see like a couple cool breast cases with him, and of course a lot of robotic surgeries as well, because he's also like really good at those. Got to see quite a bit of hernia repairs, and he let me be a little bit more hands-on in the clinic. So he let me go and talk to like a few patients, which I loved. I always love talking to patients. I got to like correct some of the translator that was translating for this lady who showed up with like abdominal pain, and the translator wasn't really doing such a good job. I think he just like really wanted to go home, and I was like, all right, well, you didn't get this information from him, so I feel the need to tell you, you know, like she's experiencing these symptoms and he's not really communicating that. So I got to like, you know, tell him that, and he like let me write notes and stuff like that. So I really, really enjoyed working with him. I think that one of the biggest things that I took away from him was our final conversation, and I honestly think that conversation really geared me into like what I wanted to do. Like, it really put things into perspective for me, because like, you know, you could hear things from like your partner, from your family, from your friends, from people that are not really in it, or people that like are on your same level or around your same level. And you can be like, okay, yeah, sure, I guess, you know, but it's something different hearing it from someone who has been through the whole process and is now an attending physician. That is now a general surgeon, you know. So the last day that I got with him, we ended up having a really good conversation, and I was like, yeah, I originally thought that I wanted to do general surgery, but I just feel like I can't have the patient interaction that I would like to have in general surgery. Like, I'm not that hands-on, I'm not that involved, and I would like to be that involved, you know. And he started talking to me about like his experiences in med school and like what his advice was as I like moved through my rotations and all of that. And when I told him, you know, like it's either OB-GYN or family medicine, he was like, yeah, OB-GYN. He's like, I didn't like it. He was like, I really liked the C-sections, right? So like the surgery aspect of it. He really likes cutting people open. And he's like, whenever I wasn't in a C-section or whenever like we were, you know, cutting, I always thought to myself, when is the next time to cut? Because that's what I want to do. So very early on, he knew that that's what he wanted to do. He had a passion for it, right? And I think for me, OB-GYN was super cool. It was like delivering a baby was the coolest thing. Gyn-onc surgeries are still super dope, but I just didn't have that, you know? I didn't have that fire in me. Like, when am I gonna cut again? When am I gonna do this again? When am I gonna, like, I don't know, see a baby be born again, you know? So I thought that was super, super important. It was a super important conversation for me to have, and I think I'll cherish it for the rest of my life, honestly, because I think he really put things into perspective for me and like what I really want and what I really want to do with my life. And I think for me, it's family medicine. I think for me, it's being able to establish connections, not just with women or not just people with uteruses, right? It's for everybody. I want to be able to have a conversation with my grandpa about his diabetes. I want to have a conversation with my tia over her hypertension, her high blood pressure. And I want to talk to my mom about menopause, you know, things like that. I want to talk to my sister about feminine health, and I can do all of those things with family medicine. I think that was the rotation where I was genuinely sad to leave, where I really grew into myself, where I was really like, oh my God, yes, let's do it. I love talking to people. I love seeing kids. You know, like even if it was just like the sports physicals and all of that, the school physicals, I think that, I don't know, I just think that that conversation really resonated with me. And he also said, you know, like really think about like where you would thrive and where your personality would thrive. And he like even suggested like, I think family medicine, you know. And like I said, I've heard it from friends, I've heard it from my partner, but it just hits different when it's a doctor telling you these things, you know? So I don't know, I really miss that doctor. I had a lot of really eye-opening experiences. I got to do a bunch of cool stuff, got to like close some people up, I got to staple some people up, you know, I got to hold someone's guts back. I got to do a lot of really cool things in surgery, so I love it. I thought it was so cool, but I haven't been in a rotation where I don't think something's cool, you know? I think medicine is super duper cool. So yeah, that's basically what my final thoughts in this thing was. Besides my actual experiences in surgery, I also got the chance to volunteer in between or during my holiday break. I got to volunteer through the health department. I got to volunteer to administer COVID vaccines for doctors, for dentists, for nurses, for assistants. So it was really, really cool because this, like, I'm part of history, you know? Like, I not only got my COVID vaccine, but I also got to administer it to so many people. And it's not like every day that people are just so excited to get a vaccine. I can't tell you how many selfies I've been in because people are like, oh my God, can I take a selfie? This is so cool. I'm getting my COVID vaccine. So, yeah, holy poop, guys. Guess what your girl just got? The COVID-19 vaccine right there. Coronavirus vaccine. How freaking cool is that? I feel so blessed. I feel so honored to be among one of the first people to get this vaccine. I think that we owe it to science. We owe it to our frontline healthcare workers. We owe it to all of the lives lost due to this freaking horrible virus. And I am honestly feeling so much gratitude. I'm feeling so blessed right now that I got this freaking shot in my arm. Who would have thought, right, that we would have been in this situation where we would be so freaking happy for a vaccine? But she's here. She's inside of me. Didn't hurt at all, like at all, not even going in. The flu shot does hurt. I'm not gonna say no, it doesn't hurt, it's fine. No, the flu shot hurts, it stinks. And this one did not sting at all, did not sting one bit. What I am feeling a little bit are kinds of a pins and needles sensation kind of going down my arm. That's pretty much it. I got out of a 5-hour surgery that was delayed 2 hours. So we were supposed to start at 10. And there was a complicated case beforehand that ended up delaying us for 2 hours, and we were there for 5 hours, and the surgeon's like, oh, what do you have going on today? And I was like, well, I'm on call tonight at another hospital. And he was like, oh, psh, get out of here, like, you're fine, you're great, everything's fine. And I was like, awesome. And then I look at my phone and there's so many messages about the coronavirus vaccine being available to us students in that hospital that I was working in. So I'm like, so I went ahead and got the vaccine. Super painless, like I said. They did have us wait outside for 15 minutes just to make sure there wasn't like adverse reactions or like any side effects, immediate side effects that, you know, if it was life-threatening, it would happen immediately after you got the vaccine. They had some snacks in there for us. They had like a bunch of chocolates and then apple juice, orange juice, and I think like cranberry juice. But you know, your girl's vegan, so she didn't really have anything. And yeah, I got to get the shot. Updated all my friends and family on that. My immediate friends and family, because that's what this video is for, if you haven't been notified that I got the vaccine. Yeah, I really hope that when it becomes available to the public that most of you get it, because it is a very horrible illness. I know that some people get it and have recovered, but that still doesn't mean that you shouldn't be precautious. I mean, that's also why we get the flu vaccine each year, right? And if you're an anti-vaxxer, if you don't, you know, mess with vaccines, then we should have a conversation, an educated conversation. If you want, obviously, like no judgment, no, well, a little bit of judgment. No, I'm just kidding. I still love you, but I do think that if you really truly are anti-vax and you really don't believe in science and you know, don't believe in vaccines, I just want to make sure that you're getting the most correct information, not off Facebook, not off Twitter, although, you know, there could be some good sources that are more digestible on those sites. I want you to get the nitty-gritty truth. And I think that's so important because, you know, we live in this era where fake news is the only news that you watch on Impacto, on Fox News, you know, child, don't even get me started. But anyway, yeah, so I just want to make sure that you that are watching, obviously you care about me. If you're watching this video, you care to know how my experience is going. I care about you, which is why you got the link to this video. Or if you stumbled upon it, I still care about you. Okay. You should really be informed, maintain yourself informed, do your own research. And by that, I don't mean TikTok or Facebook. I mean actual websites that are backed by evidence, because science is such a beautiful thing. It's such an innovative thing, and I think that we should protect it. I really think that we should do our part, still maintaining social distancing and wearing masks in public. So this vaccine is not going to eliminate that anytime soon, but we should all really try and do our part. And with that, I'm going to log off because, like I said, I have like a couple minutes left before I have to finish my tempeh fried rice and then head to another hospital to be on call till 11, and then it's break time. 2 weeks of break. I cannot wait. We'll break. It's not really gonna be a break. When is it ever a break? But yes, I cannot wait. I'm very excited, but I'm also very hungry because all I've had today was coffee, a banana with peanut butter, and apple juice after I got the vaccine. So your girl's very hungry and she's got to get ready to go to her next gig. So thank you for watching and I'll see you on the next one. Bye. Did not experience any adverse side effects. I got really geeked and I got it. So, but yeah, so I got the first vaccine and then I got the second vaccine, and both times all I got was a super sore arm. Like my arm was so sore. It has never been that sore, not even with the flu shot, but that was completely it. A lot of my classmates kind of felt really crappy, and the first surgeon that I worked with kind of felt a little sick too after the second dose. So it's not uncommon to feel sick, not uncommon to have a fever, not uncommon just to feel like tired and have muscle aches. Like that's expected. It's your body getting ready to fight off infection. They're not putting microchips in these vaccines. That should go without saying, but there's a lot of crazy stuff out there. So get your vaccines whenever you can. It's all about herd immunity. You know, I really, really want us to like be able to see each other and hug each other, spend time together, you know, sit down for a meal together, but we can't do that until we really, really get this virus under control. So I really hope that if you have the opportunity, you take it. And as always, if you have any questions about the virus, about med school, about my life, you know where to find me. Thank you all so much for watching. Up next is psychiatry. A little scared because I already anticipate being so emotionally exhausted, but I'm excited for this new adventure. So yeah, sorry for not making this a little bit more vlog style. Like I said, I was just always so tired. I was so tired during this rotation, but yeah, thank you for watching and I'll see you on the next one. Bye.